This brings us to your greatest tool of all, your licensed benefit advisor. Our workforce is 100% domestic, with offices in Utah and Texas. Representing all the major carriers, we are objective. Whatever Medicare questions or concerns you may have, we are your advocate. Our benefit advisors are the best trained in the nation, having successfully attended what we call Extend University. Your benefit advisor will be licensed not only in the state where they live, but also in the state where you live. We are here on weekdays from 8 a.m. to 9 p.m. Eastern Standard Time. For best selection of appointments, call us now at 855-535-7151. When your enrollment appointment time comes, if there is someone else that you would like to have on the phone with you while you are evaluating your options, this is not a problem. Whether it's your spouse, your financial advisor, perhaps your child or grandchild helps you with these types of decisions. Once we get your permission, we are happy to accommodate your wishes. Once your decision is made, we will have to have you on the phone, of course, to do the actual enrollment process. This is to protect your rights. 100% of the enrollment calls are recorded, and this is for your protection. Do you know where your Medicare card is? In order to enroll in a plan with Extend Health, you will need to be enrolled in Part A and Part B. You'll want to get a little box or basket and put it by your phone in preparation for your enrollment appointment. Inside, put your Medicare card, your prescriptions, your doctor information, and your questions that you have written down. That way you'll have everything available for your enrollment appointment. Your new coverage will look like this. Your Medicare Parts A and B will provide the core coverage, and you will continue to pay your Part B premium of $99.90. You will select either Option 1, Medigap and Prescription Drug Plan, or an Option 2, Medicare Advantage Plan, to cover the remaining amount. And then you will have the opportunity to enroll in a dental or vision plan if that's something you feel you would benefit from. These plans are optional. You are likely wondering, what are some of the popular plans available in your area and how much do they cost? A Plan F Medigap is a popular plan for many retirees. You will recall that a Plan F is the most comprehensive plan of them all. This example is for a 70-year-old male, and your premium would vary somewhat depending on your age and gender. So on this plan, your monthly premium would be $153 for the medical part, plus $43 for the Part D prescription drug plan, making a total of just under $200. Remember that this is the pay up front plan, and so your premium is higher, but then you typically will not have any additional out-of-pocket expenses on Medicare-covered services. You have great portability in that most doctors that accept Medicare will usually be happy to accept your Medigap. You'll notice on this example that you pay your monthly premium and then there's no additional out-of-pocket expenses. There's no deductible, no copay when you go to the doctor or the specialist, no copay when you go to the hospital, no copay when you go to the emergency room. Keep in mind, though, you do have copays with the prescription drug portion. On this plan, your Tier 1 generics would be $6. Your Tier 2 preferred brand would be $38. Your Tier 3 non-preferred brand would be $70. And your specialty drugs would be covered at 33%. Now with this plan, you can do mail order for your prescriptions, and you usually get a 90-day supply when you do mail order. This next example is a Medicare Advantage plan. This specific example is a PPO that has a $0 per month premium. A lot of people are very surprised when there's a premium for $0 a month, and they wonder how can a company offer such a plan. But keep in mind, you are still paying your Part B premium, that $99.90, and that goes towards covering the cost of your plan. Now remember that this is the pay-as-you-go plan, and so when you go to the doctor, you would have a $30 copay on this plan. When you go to the specialist, you'd have a $45 copay. If you had to go into the hospital, days 1 through 4 would be at $300 per day, and the emergency room would be at $65. The prescription drug plan is included on this example, so your Tier 1 generics would be at $8. Your Tier 2 preferred brands are at $45. Your Tier 3 non-preferred brands are at $80. And your specialty drugs, again, 33%. Also available on this plan is the 90-day mail order option. The vision plan that is available through Extend Health is through the company Vision Service Plan, VSP. This is a very respected company with many doctors nationwide. There are 2 dental plans offered through Extend Health. The basic plan is through Humana, and it runs approximately $17 a month with an annual maximum of $1,000 in benefits. The second plan is through Delta Dental. It's a more comprehensive plan, and the premium is $43 a month with an annual payout maximum of $1,600. So you're probably wondering now, what is my next step? Before you call Extend Health, you'll want to review the enrollment guide. Gather by your phone your Medicare card, your prescriptions, your doctor information, and those questions that you still have. Once you're ready, then you'll call Extend Health and schedule your enrollment appointment. That number is toll-free, 855-535-7151. As I mentioned earlier, we're not just here to help you through this initial transition. We are your lifetime friend in Medicare. Post-enrollment customer service is available to you. We are your advocates. You may be accustomed to contacting SuperMedia for your post-enrollment issues, but in the future you will contact Extend Health. We will provide support for you with any questions or issues you have with regards to your new plan. By this time, you probably have a pretty good idea of what kind of plan might work best for you. Our benefit advisors are looking forward to talking to you one-on-one on the phone and assisting you with this very important decision. It'll be a new experience for you, and you'll probably have many questions and will appreciate having someone that knows the ins and outs of insurance and will be on your side. Each year during the annual enrollment period, we look forward to hearing back from you as we review the happenings of this year and evaluate if there is another plan that may work better for you for the coming year. If your spouse is not yet 65, our ongoing enrollment services will be available when the big birthday comes. So this concludes our session for today. Thank you so much for the opportunity to speak with you, and we do look forward to talking to you on the phones one-on-one. I invite you now to listen to Module 3, where we have frequently asked questions. Thank you so much for your time, and have a wonderful day.